Hello sir, Assalamu alaikum. I'm MD Tohidur. My ID number 191291207. My presentation topic is COVID-19 feature evaluation and treatment. At first, I am to talk about what is COVID-19. At first, introduction. Coronavirus are a large family of viruses that are known to cause illness, ranging from the common cold to more severe disease such as Middle East Respiratory Syndrome (MERS) and severe acute respiratory syndrome (SARS). And novel coronavirus was identified in 2019 in Wuhan, China. Classification: coronaviruses are positive standard RNA viruses with a crown like appearance under electronic microscope. Um and there are four classify of COVID 19: alpha coronavirus, beta coronavirus, and delta coronavirus, and last and gamma coronavirus. Then I'm to talk about the feature of COVID-19. The median incubation period for SARS COVID-2 is estimated to be 5.1 days, and the majority of patients will develop symptom within 11.5 days of infection. The clinical spectrum of COVID-19 virus from asymptomatic forms to clinical illness characterized by acute respiratory failure requiring medicinal ventilation, septic shock, and multiple organ failure. Individuals who have any symptom of COVID-19, such as fever, cough, sore throat, malaise, headaches, muscle pain, nausea, vomiting, diarrhea, anosmia, or dyspnea, but we without shortness of breath of abdominal chest imaging. Cardiac manifestation: myocardial injury manifesting as myocardial ischemia or infection. And hematologic manifestation: lymphopenia is a common laboratory abnormality in the vast majority of patients with COVID-19. Gestational manifestations: GI symptoms such as diarrhea, nausea, vomiting, and abdominal pain. Neurological manifestation: beside anosmia and azisia, other neurological findings include headache, stroke, impairment of consciousness, seizure disorder. Renal manifestation: patients hospitalized with severe COVID-19 are at a risk for developing kidney injury. Then I want to talk about evaluation or diagnostic testing in COVID-19. It details clinical history regarding the onset and duration of symptom, travel history, exposure to people with COVID-19 infection, underlying pre-existing medical condition, and drug history should be elicited by treating providers. Patient with typical clinical signs suspects of COVID-19, such as fever, cough, sore throat, loss of taste or smell, malaise. Molecular testing. The standard diagnostic mode of testing is testing a nasopharyngeal swab for SARS nucleic acid using a real-time PCR assay. Serology testing: an antibody test can evaluate for the presence of antibiotics that occur as a result of infection. Antibody test plays an important role in broad-based surveillance of COVID-19. Then chest X-ray, standard radiographic examination of the chest has a low sensitivity in identifying early lung change. It can be completely normal in the initial stage of the disease. Chest computed tomography, given its high sensitivity, chest computed tomography, particularly high resolution CT, is the diagnostic method of choice in evaluating COVID 19 pneumonia, particularly when associated with disease progression. Then I want to talk about the treatment of COVID 19. General treatment to limit the risk of getting COVID-19 follow this basic precaution. Practice physical distancing for of at least 2 meters away from the other. Wear a mask properly covering your mouth and nose when working on patient, client, and when in public. Wash the hand regularly with soap and clean water or use an alcohol-based hand sanitizer. Avoid touching surface and clean surface regularly with a standard disinfectant. Keep room well ventilated with open windows. Avoid handshaking and hugs. Cover colleagues and um, sinners with a bent or tissue. Practice all the other infection control procedure with when in a clinic setting. Then I have to talk about the medicine which is effective against COVID 19. Um, uh, First, the medicine chloroquine and hydroxyquinone. Second, lopinavir and ritonavir. Third, nafamostat and camostat. And fourth, famotidine and imiphenovir and nitazoxanide. Then I want to talk about vaccine which are effective of COVID-19. The following vaccine have passed phase 3 trials with a demonstrated efficacy as high as 95% in preventing symptomatic COVID-19 infections. Some of the vaccine authorized by at least one country national regulatory authorities for public use include the Oxford AstraZeneca vaccine, Johnson and Johnson vaccine, EPVAC Corona, Convidia, and Sputnik V Corona Vac Covaxin, and the Pfizer Biotech vaccine, Moderna vaccine, and Sinopharm vaccine. This is my short presentation. Thank you, sir. Assalamu alaikum.